We work really as a team, I think, with the physicians and with the nursing staff and with the specialists that are primarily housed at Mount Ascutney, that, you know, it's possible for people to come into the health center to be seen by a specialist at Mount Ascutney and, you know, have the records and the conversation and follow-up care being done here. There's also very rich community health education programs that we tap into.
We have a lot of flexibility. I always have in my mind, you know, whatever it takes, that whatever it takes. I mean, what's it? People have all kinds of complicated and situations that don't really fit in all the boxes that, you know, insurance companies and bureaucracies have set up. And so what is it going to take to make sure that this person is safe, healthy, happy, on a road to recovery, on a road to feeling better?
There are people who move to this community as elderly people because this is where their children are. And they may have been functioning at a certain level where they were before because they knew the resources, they were plugged into the services, and now here they are in Vermont. And, you know, have been, and again, they have a long list sometimes of concerns and things that they just don't know how to manage. And I think developing a relationship with these people where you sort of chip away at that list and gradually gain their trust so that you may or may not bring their family members into the discussion, and then you see them functioning in the community.
It's something that we think about a lot with, especially with older people or with people who are disabled and kind of shut in and have a hard time getting out. It's like, we try to look at the whole person. How do you know, loneliness is a horrible affliction. And so how can we help people get connected with other people, with other people in their community? How can we help them become more involved, find work, whether that's paying work or volunteer work, you know, become more engaged in their community when at times, you know, illness can really leave you feeling isolated. I mean, I feel really lucky to work in this hospital where there's such a wealth of experience here. There are just so many seasoned clinicians, whether it's the nurses or the doctors or the physician's assistants and nurse practitioners who work here are just really experienced, caring, and it's a warm, kind of family-oriented environment.